70-year-old female with back pain, CT scan of the abdomen and the pelvis showing dilated bilateral dilatation of the pelvic-calyceal system. Pelvic-calyceal system with dilatation of the proximal 1/3 of the ureters. So if you go down, the proximal 1/3 of the ureters are still dilated with medial deviation. So if you go down, the proximal 1/3 of the ureters are medially deviated. They should be running here. They will be medially deviated and will show caliber change. Caliber change. There is narrowing here, their caliber at the level of this soft tissue retroperitoneal mass. There is caliber, a change of the dilated ureters as they are merging with an ill-defined soft tissue retroperitoneal mass. This retroperitoneal soft tissue mass is seen also para-aortic, okay? It is a para-aortic mass and extending from the level of, it started here, the soft tissue mass is starting here, okay? At the level of the origin of the superior mesenteric artery, okay? So the mass started from here and extending downwards to, this is the level of the aortic bifurcation. The mass is still seen, okay? So the mass is extending below the level of the aortic bifurcation. This retroperitoneal mass is also associated with pancreatic tail mass. This is the pancreas. Can you see the pancreatic tail here? It's markedly enlarged here with a mass, an ill-defined mass. Okay? So we have also here pancreatic tail mass. Okay? Also we have here bulky left adrenal gland. Can you see the bulky left adrenal gland? Bulky left adrenal gland, okay? There is also here a trace of pericardial fluid. This is the epicardial fat. Can you see the epicardial fat? And there is a trace of pericardial fluid. So the interpretation here, there is a retroperitoneal mass causing medial deviation of both ureters and the caliber a change at its level, okay? And also causing hydroureter and the hydronephrosis, bilateral hydroureter and the hydronephrosis above its level, okay? And also associated with pancreatic mass. Also associated with a pancreatic mass in an old female with back pain. So the diagnosis here, I think this is an autoimmune process or IgG4 related autoimmune pancreatitis with retroperitoneal fibrosis. So when you see a retroperitoneal fibrosis, try to find other parts of IgG4 related disease like autoimmune pancreatitis, seen as an ill-defined pancreatic mass. So this is the diagnosis. The differential diagnosis that the differential diagnosis, this may be not an autoimmune process. This may be a malignancy process. So the pancreatic mass may be a lymphoma, and the retroperitoneal fibrosis is secondary to this lymphoma. Okay, with secondary retroperitoneal fibrosis. So the differential diagnosis, pancreatic lymphoma with secondary retroperitoneal fibrosis. Okay, the other differential diagnosis of the retroperitoneal mass is retroperitoneal lymphoma. Okay, so how to distinguish lymphoma from retroperitoneal fibrosis? Lymphoma will be seen displacing the vessels, will be seen displacing the aorta anteriorly. Okay, so the vessels here is not displaced from the vertebrae. Okay, the aorta is still seen lying in front of the vertebrae. However, here, can you see this case? Here, the aorta here is seen displaced anteriorly from the vertebrae by a large retroperitoneal mass. A large retroperitoneal mass of soft tissue density. This is very important. So here we have a retroperitoneal mass of soft tissue density, but it's not displacing the aorta anteriorly. So this is most likely to be retroperitoneal fibrosis. However, here there is a retroperitoneal mass of soft tissue density is seen displacing the aorta anteriorly. This is most likely to be lymphoma. What about here? Here and here? There is an area of fat stranding, mesenteric fat stranding. This is not a soft tissue density mass. This is an area of fat stranding or increased mesenteric fat density compared to the normal fat density here. This is an area of increased fat density or fat stranding. Again, there is an area of increased fat density or mesenteric fat stranding, okay, compared with the other fat density. This area shows increased fat density with a halo. Can you see the halo sign? This is the halo sign of a thin surrounding capsule of high density. Can you see the capsule here? The capsule here. And here, can you see the capsule here? Okay. This is not lymphoma and not retroperitoneal fibrosis. However, this is mesenteric panniculitis. This is mesenteric pancreatitis, okay, an area of increased mesenteric fat density with or stranding with a halo of a thin surrounding capsule, okay. Uh, the other differential diagnosis is retrocaval ureter. Retrocaval ureter. The retrocaval ureter will be seen on IVU as right-sided unilateral hydronephrosis and hydroureter with abrupt medial deviation and caliber change of the ureter, of the right ureter, okay? However, the retroperitoneal fibrosis IVU findings are bilateral, not unilateral, bilateral hydronephrosis and hydroureter with medial deviation of both ureters, okay? Medial deviation and caliber change of both ureters, okay? This is the CT scan findings of of retrocaval ureter. As you can see here, this is the normal left-sided kidney. However, here, this is the right side hydronephrosis and the hydroureter. Okay, so if we go down with this ureter, yeah, this is the hydroureter, dilated proximal ureter and middle third. Okay, if we go down, can you see this? Abnormal course, okay, of the right ureter behind the inferior vena cava. This is the aorta and this is the inferior vena cava. This is the cause of the right-sided hydroureter and hydronephrosis. Okay, there's caliber change of the dilated ureter here, okay, and abnormal course behind the inferior vena cava. Okay, this is retrocaval ureter. So the differential diagnosis here, according to the hydronephrosis and the hydroureter, and also according to the retroperitoneal lesion. If the hydronephrosis and the hydroureter is bilateral, think of retroperitoneal fibrosis or lymphoma. If the hydronephrosis and the hydroureter is unilateral, think of retrocaval ureter. If the retroperitoneal lesion of soft tissue density, think of lymphoma or fibrosis. And if this soft tissue density lesion is displacing the aorta anteriorly, think of lymphoma. If the soft tissue density lesion is not displacing the aorta anteriorly, think of fibrosis, retroperitoneal fibrosis. If the retroperitoneal lesion of increased fat density with halo sign, think of mesenteric pancreatitis. So, if the diagnosis is retroperitoneal fibrosis, this may be primary or secondary. So, the retroperitoneal fibrosis may be primary or secondary. Primary retroperitoneal fibrosis is a part of IgG4 or autoimmune related disease. However, the secondary retroperitoneal fibrosis is secondary to other malignancy in the body. So in this case, in our case, there was a retroperitoneal fibrosis along with a pancreatic mass. That's why we need to exclude that this retroperitoneal fibrosis is a secondary to a pancreatic malignancy, a pancreatic lymphoma. Okay? The other possibility is that the retroperitoneal fibrosis is a primary lesion. It's not a secondary. It's a primary lesion. And this retroperitoneal lesion, as well as the pancreatic lesion, both of these lesions are parts of IgG4 related disease. Both of these lesions are parts of IgG4 or autoimmune related disease. So, what are the common parts or common lesions seen with IgG4 related disease? Okay, right and left sclerosing, right and left sclerosing, up and down fibrosis. Again, right and left sclerosing, up and down fibrosis. Okay, right sclerosing is sclerosing cholangitis. Left sclerosing is sclerosing pancreatitis. Sclerosing pancreatitis or autoimmune pancreatitis. Okay, up and down fibrosis is mediastinal fibrosis and retroperitoneal fibrosis. Mediastinal and retroperitoneal fibrosis. Okay, together with inflammatory pseudotumor. Inflammatory pseudotumor in anywhere in the body. However, the common sites of inflammatory pseudotumor are in the brain, in the eyes, in the lungs. Inflammatory pseudotumor cerebri, inflammatory pseudotumor of the eyes, orbital inflammatory pseudotumor, as well as the inflammatory pseudotumor of the lungs. What about the management? This patient has bilateral hydronephrosis and hydroureter, so he needs urgent urological referral, okay, for insertion of bilateral nephrostomy tubes to relieve the obstructed kidneys, to relieve the hydronephrosis. Okay, then he may be later on needs bilateral retrograde ureteric stent insertion.